condition where the optic nerve or the nerve of sight which goes from eye to the brain is affected, so which leads to the permanent loss of vision. So globally, glaucoma poses a very high health challenge, and it is the second leading cause of blindness worldwide. And then WHO in 2020 it said it's around 76 million in 2020, and it is projected that by 2030 it will be around 96 million. So in Bhutan also so we had done a survey in 2018, National RAB survey. It is a rapid avoidable blindness survey, and it is the second cause after cataract causing irreversible blindness. So now when we talk about the types of glaucoma, there are many types of glaucoma. We have primary glaucoma, we have secondary glaucoma. In primary glaucoma means no obvious cause is seen. In secondary, there is definite cause for raised in intraocular pressure. So whatever may be the cause, ultimately what happens is there is fluid inside the eye. So the pressure increases inside the eye and it impacts your optic nerve, so causing damage to the optic nerve. So in primary open angle glaucoma, the symptoms are not there and the pressure is not raised that much. Whereas in secondary or in acute angle closure glaucoma, the pressure is so high in the eye that you feel you have sudden pain, and the patient come to the hospital for eye examination, so they get prompt treatment. Whereas with the primary open angle glaucoma, where it doesn't have much symptoms, the patient present very late, and that's why we call it the silent thief of sight. So when we talk about glaucoma, we are talking about this nerve, the optic nerve of sight, which goes from eye to the brain. So this carries the signal. Eye is just like a camera, and this is just like a wire. The optic nerve is just like a wire, and then it goes to the brain where the image is being formed. So whenever there is damage in glaucoma, what happens is whenever the eye pressure is increased or from various causes, the optic nerve becomes quite thin. So we call it like drying of the optic nerve, but doesn't mean the optic nerve, this one is shrinking, but what happens is the nerve fibers inside becomes lesser and lesser, and it becomes thin, and then your field of vision becomes very narrow, and then you are able to see only what is in front, and your peripheral vision is decreased. So glaucoma, as I said, like it causes irreversible blindness, and then the commonest form of glaucoma doesn't have any symptoms initially. So that's why to create awareness and for early detection and early treatment to prevent blindness from glaucoma, we observe this World Glaucoma Week globally every year in the second week of March. Talking about the risk factors of glaucoma, there are many risk factors we can classify into local risk factors related to eye related, and then systemic risk factors where the systemic diseases like NCDs, diabetes and hypertension, and local eye related is especially if you are wearing minus lenses, myopia, if you have myopia, and then if you have high eye pressure, they are at risk. And then if we have other systemic conditions, like if you are taking steroid for long term also, then you are prone to glaucoma. And the other one is your age. The elder you are more prone to get glaucoma. Yes, if your family is affected, then it runs in the family, we say. So if your parents have glaucoma, then you have around 40% chance of getting glaucoma, and if your siblings are affected, then you have almost 50% chance of getting glaucoma. There are many types of glaucoma, but the commonest one is symptomless, so it doesn't have any symptoms. That's why by the time the patient come to us, their visual impact is they have already lost the vision, and then we detect very late. If a patient has glaucoma, the early signs would be, like I said, if it is other forms of glaucoma, then there can be pain, but with that, the commonest form of glaucoma, which is symptomless, So the symptoms occur only when there is 40 to 50% damage of the optic nerve. So when they have that much of damage, then the patient will see will have blurring of vision, then their color contrast will be little decreased and their field of vision will be little narrower. Ideally, no one is spared from developing glaucoma, but generally after 40 years we say as we age, our eye structures also changes, just like the aging change process in the body. Eye structures also changes, so after 40 we advise regular eye checkup. And then if you are certified as having a healthy eyesight, then maybe subsequently every 2 to 3 years, once in every 2 to 3 years. Glaucoma prevention, when we talk about, there is no 100% prevention for glaucoma, but we stress on early detection, and it can be prevented to some extent. Let's say the person has raised eye pressure, we call it intraocular pressure. But if we treat that intraocular pressure and if we treat the risk factors, then development of glaucoma will not be there, or sometimes it is slowed down. So that is our main goal. So ideally after 40 years of age, everybody should come and get your eyes checked to see if you have glaucoma. Then if you don't have glaucoma, then maybe once in every 2 years. So to protect your vision, you have to have a very healthy lifestyle, good reading habits, and then you have to have a healthy eating habits. And then you have to get regularly examined. Your eyes should be checked regularly, eye pressure, then your optic disc examination. So early detection will save your sight. So depending on the types of glaucoma, we have different treatments. The first line of treatment we have the eye drops, glaucoma medications, and then we have lasers for different types of glaucoma, and then at the end, the last resort is we have glaucoma surgery. So that is the sad thing about glaucoma. The vision loss from glaucoma is permanent and irreversible. That is why we always focus on detecting early and preventing the patient from permanent vision loss from glaucoma. So once you are diagnosed with glaucoma, the treatment is lifelong. So I always tell my patients that once you are diagnosed with glaucoma, as long as we are here, then you always have to come for a follow-up, and it's like getting married. So you have to come for regular follow-up till the end of your life. The biggest challenge we face in treating glaucoma is because of the nature of the disease, because it is asymptomatic. Then they present to us very late, which imposes us a big challenge. The other thing is when we put them on drops, the compliance to drop is very less. So most of our patients, they run out of drops, non-compliant, because they feel, since it doesn't have any symptoms, they feel that, oh, it's just one drop, so I can miss it today. So that is one of the biggest challenge we face. As of now, we don't have a very robust screening program for glaucoma, but having said that, we have ophthalmic technicians in 20 districts with all these eye measuring tools. They are equipped with the pressure measuring tools, that eye care, they can check the pressure, and most of them, they can also look at the optic nerve. So if it is suspicious, then they send to us. But most of our screening is just now on opportunistic screening. Whenever we go out, whenever the patient come to us, then we assess their optic disc. Glaucoma Awareness Week is a global event. So it is observed every year in the second week of March, and then throughout that week we have different activities. So this year what we have is at the National Eye Center, we have a screening program for 1 week, And then in other districts, like in 2 national referral hospitals also, they have similar programs. They have health talks, they have patients coming in and screening for glaucoma. And then we have in other cluster hospitals also, wherever there's ophthalmologist, there is screening program going on. So glaucoma, I would say,
ngagi mingdi lobzang dorji se shui te ngaragi yidi tashiong omrole te tatonga